So you may have been diagnosed with fatty liver disease and wondering what the symptoms are, or you may be wondering if you actually may be having fatty liver disease and what should you watch out for. Well, in this video today, I'll talk to you about the symptoms that come from fatty liver disease and what you can do about it. Let's begin. So for those guys who are joining for the first time, my name is Dr. Samir Islam. Howdy everybody. I am your poop guru, and my passion is to give you tips and tricks to help out with your gut health. If you're new to these video series, I do a lot of videos on gut health, medical education, product reviews, and educational videos just like this one you're watching right now. At any point in time during the video, click on the show notes down below and make sure to like me on my Facebook page, my YouTube page, and follow me on social media as well. But in this video today, what we will talk about is that we will talk about the main symptoms from fatty liver disease. So fatty liver disease is such a common problem that a lot of people have. And a lot of people don't realize that they actually may be having fat that goes into the liver to cause long-term damage, eventually leading to end-stage liver disease. And there may be some symptoms that you're not aware of that could be causing or maybe a sign of what's going on in your liver. So whenever we have fat that comes into the liver, that fat accumulates, causes inflammation. That inflammation causes fibrosis and scarring of the liver. And there comes to a point in time where we have too much scarring, too much inflammation, to the point where your liver doesn't work anymore. You actually end up having this condition called cirrhosis or end-stage liver disease. And once you get cirrhosis, that bridge is already crossed. We cannot go beyond that. And that can be a very difficult thing for a lot of people to have. The most common reason why people can get fat in the liver is pretty much well known. We know that weight gain, whenever you gain weight, whenever you have fat around the belly, whenever you're obese, that is a risk factor for having fatty liver disease. Diet plays a significant role. The more crappy foods you eat, the more crap is going to go into your liver, the more you're going to have a higher chance of developing fatty liver disease as well. You have certain conditions like diabetes, heart failure, coronary artery disease, or take medications for your cholesterol. Those are conditions that are setting you up to develop fat in the liver, which in turn is setting you up to develop fatty liver disease. Now the issue, like I mentioned before, about fatty liver disease is that over a long period of time, even times when you may not even be aware, that fat can lead to a condition called cirrhosis, which is liver failure, and that fat can lead to liver cancer as well. And so people don't necessarily die from the fat in the liver, they die from the fat that accumulates, causing cirrhosis and the complications that come from that, or they die from having fat accumulate in the liver, causing inflammation, leading to liver cancer. And so these conditions are usually a consequence of the fatty liver disease. Now, what are the main symptoms? This is the big question. How do you know if you have fatty liver disease? How do you know if the symptoms that you feel could be related to fatty liver disease? Or if you're having some vague pain around the liver, is that related to symptoms from fatty liver disease? So hold on. Here are the main symptoms you're going to find out. And if you have these symptoms, you actually may be having fatty liver disease. The main symptom is none. Oh, yes, this is the problem. A lot of people don't have any symptoms when it comes to fatty liver disease. You may not even realize that you have it. And this is the issue that is occurring here in the United States. A lot of people have no symptoms, but they have the fat that accumulates in the liver, and the fat over time causes inflammation and scarring to occur. It's an insidious problem. There are no symptoms. There are really typically nothing that people can feel that causes the symptoms of fatty liver disease. Now, some people may have some vague abdominal pain on the right side that can be very non-specific. That may be due to either the fat that accumulates in the liver from the liver getting bigger and stretching, but that symptom is a very non-specific symptom, and that can be due to a lot of different other reasons besides fatty liver disease. But the main thing you have to realize is that you may have the condition going on, especially if you have diabetes, especially if you take medications for heart problems, especially if you take medications for cholesterol problems as well. That may be setting you up for developing fatty liver disease. And there may be things that need to be done to check to see if you have this problem or not, and what can we do about it. Now, like I mentioned before, whenever you have this fat that accumulates over a long period of time without you realizing it because there's no symptoms, you get cirrhosis or liver failure. Now, there are symptoms from that, and those symptoms for sure can really be known and be aware of in people who may have cirrhosis. That includes things like being confused, or what's called hepatic encephalopathy, where you don't remember where you are, you don't remember a lot of things that are going on, you have short-term memory loss, or you don't sleep very well. You can develop fluid around the abdomen called ascites. This is like you're having a pregnant belly, but there's fluid actually in there. And that fluid can go into your legs, and sometimes can go into your lungs and cause difficulty breathing. It may even go into your heart as well. You just don't feel very, very comfortable. You may need to get what's called a paracentesis, or get some of that fluid removed. You can vomit blood, which is the most common reason why people from cirrhosis actually have problems, is actually vomiting from blood. And lastly, this is also another risk factor to developing liver cancer. And so when you have cirrhosis, you have symptoms, but the problem is that the things that lead to cirrhosis, especially fatty liver disease, you don't have any symptoms from that. And you need to make sure that if you have some of the risk factors for fatty liver disease, you need to talk to your healthcare provider about whether you need to be screened for this particular condition. So in summary, fatty liver disease is more and more common in the United States, and the most important thing I want you to know is that the symptoms may not be anything. You may not feel anything, but be setting yourself up to develop fatty liver problems. And this buildup of fat in the liver over time can lead to a condition called cirrhosis, which is end-stage liver disease. And once you cross that bridge, it's typically very hard to go back to having a normal liver. I want to thank you guys for joining me today. In the future videos, we'll be talking about, number one, how do you diagnose fatty liver disease, and also what we can do to treat this condition as well. I want to thank you guys for joining me today. My question for you guys is, what symptoms do you feel like you've had from fatty liver disease? Have you had fatty liver disease and didn't even realize it? Did you have some symptoms that led you to get a diagnosis of this? I would love to hear what you guys have to say. Comment down below. Let me know what you guys think. I want to thank you guys for joining me today. Don't forget to click the like button. Follow me on my Facebook page, and every Thursday I do my Poop Tip Thursday. I do a replay of these videos on my YouTube channel as well. But thank you guys for watching. Look forward to seeing you guys in more videos. Thanks and take care. Thank you guys for watching this video. Make sure to click here for more videos on fatty liver disease.